Well, hi, this is Dr. Jonathan D. Hall coming to you again from Boston with another episode in a thoughtful patient's guide to plastic surgery. Today we're going to talk about back rolls. Women are always coming in to me talking about their back rolls, how it bothers them. Frequently they come in at the time of a breast reduction, and patients don't like having the skin peeking out from their bra or loose skin when they're exercising. So, how to make it better? So, I think it's probably better to think first of the components of a back roll, which is basically fat and skin. So, if you Google back rolls, the first suggestion you'll find is diet and exercise. And diet and exercise reduces overall fat stores in the body, but not selectively. So, we should all diet and exercise, and it's a good idea, but you knew that, but diet and exercise are probably not going to selectively reduce fat rolls. They might make your overall body shape better, but not if they're specific back rolls. So I searched again on back rolls and I found suggestions for exercises that came up. And there are multiple recommendations from trainers to work out muscles in that area. And the question is, do selective exercises tighten the skin or reduce fat in a specific area? I think, unfortunately, it does not. You can't tighten skin or selectively reduce fat by exercising. So again, exercise is good, but it probably isn't going to help a back roll. So what about liposuction? You worked out, you've dieted, and you've reduced your weight, but you still have back rolls. Can liposuction help? Well, the answer, honestly, is it depends. So here's a patient of mine in her later 30s. She had a breast reduction with us in her late teens, and then she had 3 children, and she comes in now for an abdominoplasty, and she's bothered by the back rolls and the hips, and so we did liposuction for her. She had liposuction with power-assisted liposuction. She's got good skin elasticity, and you can see her 9 months after with a dramatic improvement. And she's also had 6 pounds of additional weight loss, which of course helped. And you can see where the arrows are that the back rolls are better. There's just a sense of a little tiny bit of looseness of the skin, but the back rolls are better, and she's pleased, and she has a wonderful shape. So here's a case with back rolls that got better with liposuction. So the issue with liposuction anywhere is that it removes fat, but it doesn't treat loose skin, and it can make already loose skin looser. So you can measure the fatty layer with calipers to see how thick the fat is, but how do we check for skin elasticity? Well, we have something called the lift test, and I'll talk about that in a minute. So what about energy-based devices to tighten the skin? So seems every year at our meeting or so, there's another device that comes out, and they're all basically based on the idea that you can heat skin up to a certain temperature to make the collagen shrink, but not so much that you cause a burn. And so they're wonderful, intriguing devices where the temperature monitors monitor the skin temperature while you're heating the skin, and the technology looks very interesting. But the patients that I've seen in my office that have had these skin tightening procedures elsewhere have generally not been happy. And I've seen some carefully selected results at meetings that look better in pictures, but again, the results really aren't dramatic. So I don't perform skin tightening energy-based devices in the office, and so that's my caveat. And it may be helpful for people that have only a little bit of skin laxity, but generally I don't think it's helpful for people that have significant skin laxity. So again, how do we check for skin laxity? The lift test or lift maneuver. So if you put your hand on the skin and lift up and the back rolls go away, then the problem is loose skin in that area, and it's not going to get better with liposuction by itself. So this shows a patient of mine with the back rolls, and she's marked for bra line backlift. And lifting up the skin, we can see the dramatic improvement. And then afterwards, the third picture on the right is after she's had a bra line backlift. So my philosophy is always trying to select procedures with a patient that I think that the patient are going to be happy with. And so when I'm sitting in my chair in the office, I'm always asking myself, do I think that this patient in front of me and myself will be happy in 6 months with the procedure that we're talking about? And will they be glad and say, I'm glad I did it? So bra-line backlift is a good procedure because patients are thrilled with it. The downside is obvious. There's a permanent scar across the back that's hidden under the bra, and not everyone wants the trade-off of this scar. And so the patients that are okay with it love it. And I've been impressed that every patient I've done a bra-line backlift on in the last 34 years has been happy with the trade-off. And the reason I think that they're not going to show off their back without a bra anyway, and they love getting rid of the loose skin that moves around when they exercise or bulges out from under their bra, and the look once they put their bra on. So again, a procedure that patients are happy with as long as they accept the trade-off of a scar. So here's a woman in her early 70s who had an abdominoplasty and a breast lift elsewhere, and she's bothered by drooping of the skin at the lateral breast and the back skin, and she's had liposuction twice, 2 years and 1 year before at a major hospital in Boston, and she came in to ask me if I could do liposuction better. And so I told her the problem wasn't that the liposuction was done well, it just wasn't the right procedure. And we did a lift test and the skin laxity went away. And so after discussion, she elected to have a bra-line backlift. So here she is shown before and 6 weeks after the bra-line backlift. And here she is with her bra on just before and 6 weeks after surgery. You can see how it really helped to smooth the skin around the back, and she was thrilled. And the markings with the bra off and the incision with the bra off 6 weeks after. And so the oblique view bra on before and after. And then the bra off before and after. So here's another patient of mine in her later 50s who's very athletic. She loves to ski and run and play tennis, and she was bothered by large breasts, but also by loose skin of her back. So I performed a bra-line backlift at the same time as her breast reduction, and she's shown here, and again 6 weeks after. And we've tightened the sides and the back, and she loved the improvement. Here's another patient of mine in her 50s who's had a breast reduction and abdominoplasty, and she asked about liposuction of the back. So she came in, and I did a lift test, and I said, liposuction really isn't going to treat those back rolls because it goes away when we lift up, and you're going to need to think about a scar across your back. And she said, oh, I don't want that. And then she thought about it, and she came back, and we did a bra-line backlift. And here she is shown before and 6 weeks after, and it's a dramatic improvement. And bra on before and 6 weeks after, you can see all the back rolls before, again, same size bra, and after, dramatically smoother and better. And here she is, side view, before and after. That scar comes right up along the side of the breast reduction scar. And here's the before and then after with the bra on to the right. So what about cryolipolysis, also known as CoolSculpting? So here's a patient of mine in her later 40s who had CoolSculpting of the bra line rolls. And I've heard at the meetings that CoolSculpting is good in the back roll area. That's one of the areas where it's supposed to be pretty good at. But when we look at her, I've marked in the blue arrows, it shows kind of a dent in her middle back where the paddles were applied from the CoolSculpting, and she's still out of proportion with the thickness of the fatty layer above, and she still has back rolls. So she's out of proportion, still has back rolls, and wants to get better. And I don't know if you can tell, but she's got so much fullness around the shoulders now that it's hard to kind of get her arms down at her side. So I performed power-assisted liposuction in the areas marked in red, along with the bra-line backlift. And you can see, if you look, that she's actually able to get her arms down by her side better in the after view. And the side view shows before markings and after. And an oblique view shows before and after. So here's another patient of mine in her mid-70s. And I actually did liposuction of her back at the same time as her hips and an abdominoplasty 17 years before. And she's had a lateral incision thoracoplasty, which again I performed, which hides the scar along the lateral edge of the breast to tighten the sides. But she's still bothered by loose skin in the back. She's 5'1", 137 pounds. The redness on her back is from having burned herself with a hot water bottle, so a temporary thing not related to the surgery. And so she's shown before and the markings. And then here she is after several months, showing the scar and showing the bra on and showing how all those areas are tighter. So here's another patient of mine in her early 40s who's had a 140-pound weight loss after a gastric sleeve procedure. And so here she's shown before and then again after a bra and back lift combined with a posterior incision brachioplasty. So a brachioplasty is, of course, an arm lift. So here she has the markings before for both and after. So again, brachioplasties and breast reductions are commonly combined when necessary with the bra and back lift. So here's a mother of two in her later 40s. She's had a breast reduction with her office 25 years before, but since that time she's had two children. Her breasts have grown from a C cup to a D cup, and so they just feel a little large to her. And she's asked us to do a second breast reduction, and she's also bothered by the back rolls, and so she's asked about a bra and back lift. So here she is shown before and again 4 months after surgery. And here are the markings before on the front and on the side. And we mark again with the bra on to make sure the scar is going to be hidden underneath it. And so here she is before on the left and after the secondary breast reduction and bra line back lift. And you can see a dramatic improvement of the breast, the sides, and the back. And this is 4 months after surgery. So here's a mother of three in her early 40s with macromastia and back rolls. So she asked me to do a bra line back lift at the time of her breast reduction. So here she is on the left. Before, the inset shows the markings and the post-op result on the right after several months. A nice tightening and improvement. And here's the side view, marked before, markings up above, and then after on the right. So here's a patient of mine in her later 60s with breastosis and some macromastia and back rolls. She's a little thicker at 5'5", 192 pounds, but still bothered by back rolls, and it's a little easier to do this procedure when your fatty layer is thinner, but we still were able to get a nice result for her. You can see the shape on the left, the markings above in the inset, and her after result on the right after about 6 months. And we can see the side view on the left with the markings for the breast reduction lift and her bra and back lift with the outline of the bra marked in red and the surgical markings in black. And you can see before on the left and after on the right. And just a dramatic change in her upper torso with her breasts and her back. She was really quite pleased with this. So here's another patient of mine in her early 60s who had breast asymmetry with a D cup on the left and a triple D on the right. She was symptomatic with back and shoulder pain. She's also had a right shoulder replacement, and she was bothered as well by back rolls. So she elected to have a bra and back lift at the time of her breast reduction and asymmetry correction. So here she is on the left before, markings in the inset, and after on the right. Again, dramatic improvement. And here she is before on the left and after on the right. And she's lost a few pounds in between, which of course has helped. So today we learned about back rolls and methods to improve them, when you can get better with diet and exercise, and when we can do localized fat removal with liposuction or cryolipolysis. But we've also learned that those two things to remove fat don't help significantly with the back rolls if there is significant skin laxity. We've learned to diagnose the skin laxity with a lift test or lift maneuver, and we've learned about a bra and back lift, which trades a scar under the bra for tighter skin, but gives us happy patients and people that are willing to accept that trade-off. So again, this is Dr. Jonathan D. Hall coming to you from Boston, and I'd like to thank you for listening.